The name of my practice is South Texas Wound Associates. We go by Wound Doctors, wounddoctors.com, and we are physicians-led wound care team, and we direct wound care program in multiple hospitals. Right now we have 2 hospitals, mainly Northeast Baptist and Mission Trail Baptist Hospital, where we have our practice. If you really look at the technologies for wound care is concerned, there are so many new things that's coming out. Last year we started using epidermal grafting, which we could do it in the clinic before these patients had to go in operating room. Now we are able to harvest epidermal cells from patient's skin, and then we are able to put those cells in the wound so that the wound can heal quickly. So those new technologies we implemented last year. Then we have amniotic cells which are available, stem cells which are available to help the wound to heal quickly. There are a lot of new patient care related education material online, and the EHR technology that has been implemented last year, which is continuing to evolve in our practice. The patient getting real-time advice, that's the best, and able to talk to the physician in real time or real seconds. If they have some question, they can talk to me right away. My wound is looking not good, they can be able to send me a picture. I can tell them what they need to do right away, rather than for it to wait till 48 hours and now they are in emergency room. Okay. So definitely it is a pretty advantageous to the patient too. This is something where we are really worried about it. I still remember on September 30th that we were worried what's going to happen on October 1. But when the transition really happened pretty well, I know there were like many codes, 68,000 codes than what we had before. We had like only 13,000 ICD-9 codes. So there were a lot of codes there, and people were worried about it, how they're gonna do the interface and the change. But as long as you had electronic health records, they were able to upgrade the electronic health records, they were able to get those ICD-10 codes into the system. There were even ways of changing ICD-9 codes to ICD-10 codes automatically. So a lot of our patient charts, automatically we were able to convert into ICD-10 codes. So the transition was much smoother than what we were expecting about. And though we had to do education to all our physicians, we had to really get them up to speed, because there were a lot of codes that they had to be familiar with. There were a lot of specific ICD-10 codes that they had to be familiar with, because a lot of these things were getting very specific with ICD-10. So there were a lot of education that went through to make sure the transition was good. There were a lot of online tools that were available. We have ICD-10 survival kit available that was out there, which was easy to search any code. So there were a lot of things out there which helped a physician to transition. The meaningful use definitely is an extra burden to physician. It definitely takes physicians away from patient and puts them in doing some work which is not patient care related. So you're basically trying to do a lot of these things at the end of the day, and the physician's days are getting longer because of this increasing regulations. So we are definitely, organized medicine is focusing on decreasing this red tape as we go along, because we want our physicians to be more with patients than be more with computers, and that's what the patients want. They want good physician-patient interaction. But at the same time, we were able to transition, because these are mandatory things, and physicians are going to face penalty if they did not do whatever it was necessary for the meaningful use. So we had to go through a lot of education. There are a lot of online tools that's available. Our physicians are spending extra time to make sure they do the notations in the EHR. A lot of electronic health records are able to extract the information from the records itself and then reporting to the CMS. So that's happening. So there are new tools available to make it easier for the physicians to get this done. And we were able to report meaningful use. Our practice was able to do that, and we will avoid penalty, though we may not be able to get the extra bonus that they had asked they will give if we do better with our meaningful use reporting. So that's what our practice was able to do.